Ready? So I knock on the door and I'm in the patient's room. I'm going to perform hand hygiene and I'm going to introduce myself. My name is Michaela Kicklider. I'm a student nurse at the USA College of Nursing and I'm going to be performing your musculoskeletal exam today. Is that okay? Okay, so first I'm going to inspect your knees and I'm going to look for the color and see that they are slightly tan. I don't notice any cyanosis or bruising or any swelling. So now I'm going to palpate your knees. While I'm palpating, I'll be feeling for any masses or swelling or deformities. I'm going to palpate both of your knees. While I was palpating, I didn't notice any masses, swelling, or deformities. I also was feeling for the temperature, and I saw that your knees were warm bilaterally. Did you feel any pain or tenderness? Good. So now I'm going to test your musculoskeletal strength. So I'm going to ask you to just put your arms out in front of your face like this. Raise them up just a little further. And now I'm going to pull on them, and you just resist me, okay? Good. Now I'm going to push on them and you push towards me. Good. So your upper extremities are 5 out of 5. So now I'm going to place my hands on your knees and you just push up, okay? Good. And so now I'm going to come down to your ankles and just relax them. I'm going to pull out and you pull toward yourself. Good. And now I'm going to push and you push towards me. Good. So your lower extremities were 5 out of 5. So now we're going to test your range of motion, okay? So I'm going to ask you to stand up and just stand right over here, okay? Alright, so first I'm going to get you to open your mouth and now protrude your jaw and go side to side. Good. And so now for your neck, we're going to get you to do your chin to chest, that's flexion. And now I'm going to get you to your head sitting straight up is extension. And now move your head back, and that's hyperextension. So now we're going to do lateral bend, so do ear to shoulder and ear to shoulder. Good. So now we're going to do rotation. So now look this way and look the other way. So your rotation is good. So now I'm going to have you put your arms straight up like this, and that's flexion. Your arms by your side, extension, and your arms behind you is going to be hyperextension. Good. So now I'm going to have you put your arms over your head. That's abduction. Your arms next to your side. Good. That's abduction. So now I'm going to have you do your arms behind your back, but I'm going to have you do your arms like this. That's internal rotation, and I'll come up like this. External rotation. Good. So now I'm going to have you do this. Bend your elbows up like this. That's going to be flexion. So do your arms straight. That's extension. And now lock your elbows out, and that's hyperextension. So now put your arms back up like this and put your hands facing the ground. That's pronate. Now up, supinate. And now for your wrist and your fingers, I'm going to have you have your wrist bent down towards the ground. This is flexion. Your hands flat out, extension. And now do like this, like a high five, and that's hyperextension. So now what I'm going to get you to do is make a triangle with your wrists. And this is radial deviation. So now put your arms out like this. That's ulnar deviation. So now what I'm going to have you do is bend your fingers down. This is flexion. Now hands flat out. That's extension. And now fingers up as far as you can go, and that's hyperextension. So now I'm going to have you make a fist with your hands. That's adduction. Now spread your fingers out. Abduction. So now I'm going to have you hold your hands up and just touch your thumb to each one of your fingers. Good. So now everything we've done has been done bilaterally, but now we're going to move to your lower extremities, and we're just going to have you do one of these at a time, okay? So if you want to, you can come, you can brace yourself, because we're going to have to do some leg movements. So now for this one, here, move this way for the camera. So now what I'm going to have you do is I'm going to have you bend your knee and rotate it inwards. That's internal rotation. Now move it outwards. That's external rotation. And put it back down. So now I'm going to have you kick your leg out to the side, like this. Abduction. Now bring it back down to the floor. That's adduction. So now what we're going to have you do is I'm going to have you bend your knee up and lift it. That's flexion. So straight down. That's extension. And then now move your leg behind your body like this. That's hyperextension. Okay, good. So now have your foot. I want to have you hold your foot out, point your toe to the floor, and that's plantar flexion. And now put your toe to the sky. That's dorsal flexion. And now turn so without moving your leg, just turn your sole out. That's eversion. Sole in, that is inversion. So now I'm going to have you curl your toes. You can't see mine, but curl your toes. That's flexion. Now spread your toes out. That's extension. So I know that you have full range of motion in all of your joints, and now we're going to check your spinal flexibility. So what I'm going to have you do is bend down to the ground like this. That is going to be called flexion. Now I'm going to have you stand straight up. That's extension. And now I'm going to have you bend backwards. Good, hyperextension. So now you're going to do lateral bend. So you're going to bend side to side. That's for your lateral bend. And now without moving your hips, just rotate your upper body. And that's for rotation. Good. So now I'm going to inspect your shoulders. Here, I'm going to inspect your back. So I'm going to inspect your spine now and see that your spine is straight and in alignment. Your shoulders, scapula, and iliac crest are even. Your cervical spine is concave. Your thoracic spine is convex, and your lumbar spine is also convex. So now I'm going to check for scoliosis. And if you will, just remove your shirt for me. Thank you. And now face away from me. And bend and touch your toes. Good. So I see that your shoulders, scapula, and iliac crest are both even. You can stand back up now. And that completes my musculoskeletal exam.